everybody, it's Dr. Brian Prax, and today we're going to be teaching a little segment on plantar fasciitis. So just for the record, here's how it's spelled. It can be a little challenging to spell it, but even more challenging to identify what is it and what causes it. In our office we deal with a lot of foot pain, so one of the things we really need to identify is where is that pain coming from? Is it peripheral neuropathy? Is it the sciatic nerve that's coming out of the lower back that goes down to the foot? Is it neuropathy, like say from chemotherapy, or is it from diabetic neuropathy, or is it from this condition, plantar fasciitis? That's what we really need to identify, is where is the symptom coming from. So today is all about plantar fasciitis. So let's go into a little anatomy. If we take a look at the bottom of a foot, just like this, we're going to see obviously the heel, and we call that the calcaneus, and on the opposite side, these are our metatarsal joints right here, where the end of the foot meets with the toes right there. What's critically important about that is that we have a band of tissue that connects to each of these 5 bones here, and they all go all the way down and then connect to the heel bone right there. This is a really strong fibrous tissue, but just like anything else, it can be damaged and it can be irritated. Some of the things that will irritate it would be excessive long periods of standing. A second thing, and oftentimes they're connected, is excessive pronation. So what's pronation? It's when the arch rolls in, flat feet, dropped arches or whatever. But when the arch, this is what a foot looks like here on the bones, when the arch rolls in, it drops, and then that curve that, I'm trying to show you here, there you go, that normal curve that's here is flattened out. And when that's flattened out, that's going to lengthen the plantar fascia, and then that's going to swell, which we call itis. So plantar fasciitis really just means swelling of the plantar fascia. Now it could be that it's just irritated, which is causing the swelling, or it could be that it's literally ruptured. Now usually on a rupture you can feel that, but the point is we need to figure out, is it plantar fasciitis? So we said that a dropped arch can cause it, a rolled in arch can cause it. Excessive periods of standing on your feet, especially in poorly supportive shoes, which are most shoes out there. Unless you're wearing something with good arch supports, like say a Dansko, the cloggy things, or like Birkenstocks, most shoes out there are flat, so that's going to allow the arch to drop. Now another thing we know is that 77, almost 80% of Americans are overweight. Well, being overweight or obese is obviously going to put more pressure onto the foot, flattening things out and stretching out that plantar fascia. So that's a critically important thing as well. Now for those of you who run, that would be like accelerating, decelerating, athletes, things like that. That can cause irritation of the plantar fascia as well. And then for us runners, that can also be affected or irritated by heel striking. So heel striking is as you're running here, the heel is hitting first and then we roll through. Believe it or not, there's a lot less stress landing on the forefoot. So we really want to look at our heel strike. So, or really want to try and move our heel strike toward either a midfoot or a flat foot. So with this heel pain though, and plantar fascia pain, it can be so painful, I've had it myself, that it feels like, especially in the morning, first thing in the morning, it feels like you're stepping on glass. It's that painful. So what I want to do is go over some keys of things that you can do. So things that you can do to help prevent that, obviously you can do ice and you can do anti-inflammatories, those will help with the pain. Heat can help soften that, massage can help out it as well, but all of those things that I just mentioned are just going to help out with the symptoms. So kind of reverse engineering, well, if we know what the causes are, then we can help to treat those things. One of the things that I have found personally with my plantar fasciitis is to make sure that I have a really good supportive arch inside of my really good shoe. This is a custom orthotic. You can probably get an idea of how big my arch should be. This is going to prevent my arch from rolling in, and it actually feels really good on the plantar fascia. So that's a custom-made orthotic. The ones I use have 1, 2, 3 of all 3 of those arches are supported. But having said that, if you're overweight or certainly if you're obese, then somebody's got to look at reducing the weight. So I have a lot of videos on weight loss, but I think that's a critically important thing for so many reasons, but especially for the continual irritation of this plantar fascia, which we call plantar fasciitis. So stretching it, I always recommend to patients using like a golf ball, lacrosse ball, or even a tennis ball. You just put it on the floor there and you just kind of roll it around, roll it around, roll it around, and just this stretching of it can really help as well. So other things that you can do, you can get these online. You can also get to your physical therapist or even a personal trainer. You want to get into some inversion strengthening. So the inversion muscles are the ones that are going to prevent the foot from dropping in and rolling in. So you want to look up inversion muscles and you want to work on strengthening those. So that's pretty much it. We want to look at the biomechanics of the foot. We want to support an arch that's dropping. We want to really see about losing weight to optimize your weight. When it is really, really hurting, you want to make sure that when you're on your feet, you want to be supported. You want to get that orthotic in there. And then you really want to limit activities that you know are going to hurt. So if you're doing something and it really starts hurting, instead of just popping a Tylenol, you got to get off your feet until we get this thing healed up. It's like a scab that you just keep pulling off and pulling off. So eventually you got to really stop that. And then okay, it says here controlling of excessive pronation. That again is the rolling in. So those are some tips that can help out. With your plantar fasciitis. We have another technique which in a different series here or a different video I'll explain is called trigenics. It works incredibly well for plantar fasciitis. I'll cover that in the next segment. But until then, hope this helps and we'll talk soon. Thank you for watching this video. If you like the content, I would ask you to hit the thumbs up button to like it. You can share it with a friend, subscribe to my channel, and please comment below. I will read it and I will respond. Thank you and have a nice day.